So today I'm going to talk about three main things. I'm going to tell you a little bit about what my career path has been, and getting into community-based research and evaluation. And I'm going to tell you about CCRP, California Center for Rural Policy, our approach to research, a little bit about our projects, and some of what we've learned from the projects that we've done. And then I'm going to talk a little bit about your career path and ways you can think about setting goals for yourself and being prepared to say yes to the right job when it comes. So those are the three main things I wanted to talk about. And then there'll be some time for questions. So I'm the Director of Health at CCRP. I've been there for, it'll be about 6 years, or will be 6 years in January. So I'll put my dirty little secret out right at the beginning. I never was really sure what I wanted to do. I know some people know exactly what they want, which is great, and but I wasn't one of those people. And I knew I wanted a job where I could be of service, and that, I took a sociology class my freshman year of college, and I just liked it right away. And that's what I got my bachelor's degree in, and then my master's as well. So I came here for my master's degree because I was ready to go somewhere new and go on a new adventure, and I had liked what I learned about Arcata. It sounded like it would be a cool place to live, and where I lived in Colorado, Durango was really in like a beautiful natural setting in the La Plata Mountains, and lots of hiking and rivers and beautiful places to explore. And I was like, oh, Arcata sounds really nice too, except I get to be near the ocean. I got my master's in 2002, so time really flies. It's been a while now. When I was working on my bachelor's and master's, I worked in offices at the university. I was an administrative assistant in the Office of Student Affairs. I helped raise funds in alumni relations here at Humboldt. And so those were, the first one was like a work-study job I had. I also had miscellaneous jobs in college. I worked at a couple bookstores. I worked at Baskin Robbins for a summer, always trying to keep my, earning some money to help pay for my college expenses. And my very first job was babysitting, but my first actual job was Burger King when I was 16 years old, and we punched in on this little computer, old school computer. I got my first email address when I started college, so I guess that dates me a little bit. And then after finishing school, this was mentioned in my introduction, but I spent 4 years at a little research institute here at Humboldt State with a long name, but the acronym was CASE. And I was a senior research analyst there. And one of the main projects I worked on was called New Horizons, and it was for youth who were actually incarcerated in a facility. It was a locked facility. They were young people who had had a lot of trouble with the law, and this was like a local facility where they could be instead of getting sent to the California Youth Authority, which is like prison for people who are under 18. And we did interviews with all the young people when they exited the program and did the evaluation. It was a big project. I learned a lot from that project, like talking to youth and looking through their files and learning about their backgrounds and challenges and some of the reasons they had gotten involved with law enforcement. And it was an innovative program run by the probation department. They had a garden, they had school every day, they got mental health, substance abuse counseling. They were, trying to address some of the problems that young people were having, but it was still, the kids were locked in these small rooms and locked in. So it was really eye-opening experience for me. That was one. I also evaluated a lot of the AmeriCorps programs that were just starting in Humboldt at that time. And then I went to the Department of Health and Human Services. I worked in public health. I was an administrative analyst and then a senior health education specialist. And that was where I did like youth traffic safety, alcohol and drug prevention, injury prevention, and met a lot of people in the community that way. And I stayed there for 7.5 years, and then I came to CCRP when a position opened here that I was really interested in. And here's where I have remained. So what I always joke that I don't think that my husband or my parents know what I do. And it's kind of hard to explain because we have so many different projects and every day is different, and but there are specific things that I do in my role. And so these are some of them. Some of them you can kind of get what they are, and some of them you're like, well, what's conduct program evaluation? But I write a lot of grants, and when we get projects, if Economic Development Division of Humboldt comes to us and says, we want you to do a feasibility study, I'll kind of scope the project. So here's what we're gonna do for the project, and here's what we will deliver. I attend a lot of meetings and facilitate meetings out in the community. I do a lot of writing of reports. Luckily, I always loved to read, and growing up, and it I think really helped me become a good writer, and that's good because I have to do a lot of writing. I collect and analyze data. I interview people. I design interview questions. I conduct focus groups and design questions for focus groups. We go through the IRB approval process through the university for all our projects. I manage projects that our research analysts do. So we have a team of research analysts and a team of student research assistants. And sometimes a student research assistant will progress into being a research analyst. And so I help kind of keep projects moving and support our staff in delivering projects and writing reports, and kind of doing, a lot of our analysts do a lot of the same kinds of tasks. I do a lot of presentations to different groups, not often with a microphone, like I said, but in collaborative meetings, and I present data, results. We talk about results that we get from projects. Done a lot of strategic plans and needs assessments, and a lot of the issues I work on are tough issues. Substance abuse, suicide, adverse childhood experiences, access to oral health, access to health care. Some of these problems really manifest in a unique way in a rural community, and a lot of rural communities kind of have similar challenges. So this is some of what I do, my role. So moving on to a little more about CCRP. So we are a part of Humboldt State University. We're part of Sponsored Programs Foundation, which is the nonprofit arm of the university. So it's funny, when I meet people and I say I work for Humboldt State, they'll often say, oh, you're a professor. I say, know, I actually work for I'm not a professor, I work for the nonprofit arm of the university. And like SHOT's Energy Research Lab is also a part of sponsored programs, as well as when faculty bring in projects, grants, those run through SPF, is the acronym for sponsored programs. And CCRP was founded in like 2006 or so. It's actually a really similar institute to the first institute I worked at out of the sociology department, doing kind of community-based research and evaluation. And both those institutes utilized CBPR, which is an approach to research. It stands for community-based participatory research, and I really kind of tried to boil it down because there's a lot you could learn and study about it. You can go to a 5-day, week-long training about conducting this type of research. But the essence of it is that it involves everyone in the research and evaluation and in all phases. And so that's the kind of participatory piece. So researchers or evaluators work collaboratively with people who care about the project. So it could be project staff, it could be people who are using the services provided by the project. We call them key stakeholders. So it could even be like a city council member who's really invested in a project. Anyone who really cares about the project can be a part of the team. And a really critical part of what we try to do at CCRP is translate what we learn from research and evaluation into policy change or policy recommendations. So, and some of this will come out when I talk about our specific projects, but it's really research in the context of what can we learn from this to help improve the health and well-being of people who are living in rural communities. And sort of fundamental to CBPR is the sharing of power, resources, results, and knowledge. So we often will produce reports and it's like, we want people to use those reports and present that data, and we want to make recommendations for next steps, like other things you could do if you want to investigate further an issue like access to oral health, for example. So this is all kind of up there, but I want to talk now about some of our areas of focus. And we do a lot, and a lot of our projects are driven by what people or organizations in the community, they come to us and say, will you help us with this? So a lot of times it's like we're filling a need that someone in the community has. And that's how we get a lot of our projects. We do write grants and project proposals to funders and things like that, but often, in fact, I'll tell you, when I get to them, a couple projects where someone in the community just came and said, we need help with this, we need data, we need some research because we need that kind of information to compel people to act on this issue. So I'm going to talk more about our Adverse Childhood Experiences project, which was really interesting. Our tobacco prevention and suicide prevention are mainly evaluations with United Indian Health Services, and they're a great organization. They're like an integrated health center that provides oral health, behavioral health. They have a community wellness division, all under one roof, and then of course medical. And so we've been working with them, and we have a teen parent and pregnancy program that we do an evaluation for with them too. We've done a lot of work with food security. We did a large-scale survey with people who use the food pantries in Humboldt County, and we wanted to learn more about their experience of using the pantries. but also just more about them, like what was their health status, their job employment status, were they getting access to medical care, did they have transportation barriers, which was really interesting. And then we did an evaluation for the OSNAP program here on campus. And I'll tell you a little more about that. We learned some interesting things. We did a cannabis equity assessment for the county, for the Economic Development Division, and it was about, as cannabis becomes a legalized industry, how do we create equity for people who to enter into the legal industry? So we did a lot of research on the war on drugs and how it affected particularly people in Humboldt County. So it's like this thing that was once criminalized has now been decriminalized, and how do we create pathways for people who might have suffered from criminalization to get into the legal industry? And it's an issue that's being talked about around the state. It's really fascinating project, even though we had like 10 days to do it. We had a really tight turnaround. I was like, this needs like months of research, but we had to work in that time frame. And then the county of Humboldt was able to draw down dollars. Once they had that report, that equity assessment, they were able to draw down funding to actually create an equity program, which they're doing. And then we've been working with the County Office of Education and with Humboldt State and College of the Redwoods around trying to create pathways to health careers. So we're really, we really have issues with recruitment and retention of clinicians, doctors, dentists, like psychiatrists, and there's always vacancies in these positions in Humboldt and Del Norte. And so we're trying to create ways for kids in junior high and high school to start thinking about health careers and kind of have a pathway for them to pursue those careers and then hopefully come back to Humboldt and practice. So really diverse kind of portfolio of projects that we have. And then there's more than that. Our executive director works a lot on broadband access, so trying to get everyone in all our rural counties to have access to the internet. I'm going to talk more about our oral health project with the public health department and our community building project. But I did want to point out a lot of what we do is about population level health. So we're not so much studying or following individuals. We are looking at the overall health of the community, and it's kind of different indicators you look at. So you might look at mortality, like for populations of people, like do certain groups of people die sooner, and what's happening with that? We talk a lot about social determinants of health. So all the things that affect your health other than like, yeah, health doesn't happen just at the doctor's office. Like you have to have access to education. You have to have access to like trails and parks where you can be physically active. You have to have access to healthy food. And you have to be able to afford that food. All these, your housing, if you live in a house where the roof is leaking and you don't have working refrigerator, all these things have an impact on our health. And so these are the kinds of things we talk about a lot with the community partners. And then I talked about some of the work we're doing with United Indian Health Services, and we've worked with the, like 9 of the local tribes on some efforts they did to improve health and wellness. So they, built community gardens. They installed trails around the community gardens. They started up youth programs. They limited sugar-sweetened beverages at tribal events. They did all sorts of amazing, wonderful things through a grant that we helped evaluate. It was really a great project. And then I talked already about some of the workforce development. So kind of a smattering of what we do. I really like when we can do listening campaigns. We can just go and talk to people and listen to them, either one-on-one or in groups. I'm going to talk about OSNAP in a minute and what we learned from that, and I'll talk some about the oral health needs assessments that we've done. We did one for Humboldt County and for Trinity County, and we're both rural counties, but we actually look really different. Like Trinity is all frontier, which means that's the designation beyond rural. So and those designations are set by the government based on the number of people per square mile. And so Trinity is a lot more rural than Humboldt. Weaverville is the largest population center, and it's very small. Del Norte County to the north is also quite a bit smaller than Humboldt. And it's funny when you compare, there is rural, like Arcata rural and Eureka rural, and then there is really rural, like Bridgeville out on Highway 36, or Mad River, or Petrolia. And the needs are really, really different. Every time we do a project in one of those more remote communities, I'm like, wow, they have a whole different set of challenges. They have to drive over an hour to get to a grocery store, or to get to the dentist, or to a doctor. And just as an example, in Trinity County, we found that even people with private insurance were driving over an hour to see a dentist. If you have kids and you're working and you have, hopefully you have a working vehicle, it's a significant barrier. So we really learned a lot about Trinity County when we did that needs assessment. And then we did a needs assessment for the child care here at HSU, which also is really interesting, what we learned about the needs of students and staff and faculty, and the importance of having on-site child care, high-quality child care available. I talked about the pregnant and parenting teens with United Indian Health Services. Lately, we've been doing a lot of needs assessments. We always try to include like an assessment of strengths too, because often we have both. We have things we need, and we have things that we're good at. And then we do a lot of facilitating and convening of all different kinds of community partners. So some of what we've learned, these are kind of general things that I've learned through working at CCRP. So first of all, the value of listening cannot be underscored enough. How much we learn when we stop talking and listen, and allowing and creating spaces where people can talk. I did, for a project, a focus group with foster parents, and I realized they didn't have a lot of opportunities to talk about what it was like to be a foster parent and what they were experiencing. And so much kind of came up about, these are people who are really trying to help some of our most vulnerable youth. And it just kind of felt like there weren't many people really listening to them. Rural communities are unique. We have unique needs and strengths. And when we're working on complex social problems like addiction or suicide, or health inequities. It's complex, and it really requires like multiple strategies, multiple agencies. Many of these problems, they cannot be solved by one agency. They can't be solved by one program. It's like a multi-tiered, multifaceted approach. And even then, these are really entrenched social problems, and they're hard. It's hard to move the needle on these things. And then some of the struggles that rural communities are dealing with right now. I talked about recruitment and retention of healthcare professionals and oral healthcare professionals. And we have a lot of food deserts in the county and in other rural counties. So it's not just healthy, fresh food, but it's affordable. It needs to be affordable, and it needs to be accessible. And a lot of communities, when you think about, in fact, just the other day I read an article that was about how hard it is to keep fresh food in your house if you have to drive over an hour to get to a grocery store, which I don't think of because I live in Arcata and I'm just I'm a couple miles from a number of grocery stores. And maybe all your food doesn't come from the grocery store. Maybe it comes from your garden, which then you can get access that way. But you know, I don't have a garden in part because it's a lot of work and investment, and you got to take care of it. And if you're really, you know, struggling to make ends meet, that can be a hard thing to do. The other big thing we've learned that comes up all the time is just that state and national surveys, they sampled just a few people from communities like Humboldt. And so you'll see these national sources of data, and it's really hard to know if they accurately represent a community like us, because they lump all rural communities together. And you can understand why there are fewer people in rural communities, but the truth is that it becomes hard to extrapolate and say this is true for Humboldt, because we don't really know if they only talk to 5 people in Humboldt. That's not representative. So this is something we come across all the time. Some of what we do is try to create local data so that we can answer those questions more confidently. And there are a lot of other institutes other than ours that understand and work on this. So I told you we did surveys and focus groups with students at HSU that use the food pantry or part of OSNAP here on campus. And so some of the things we learned when we did those focus groups and surveys were, some might seem like common sense, but when you ask people and they answer and it validates your hypothesis, and you're able to document it and share it, and it goes to people like the vice president or president or to the CSU system, it's like, okay, this is obvious, but our research validated it. So this is some of what we learned, that in order to get CalFresh, you have to reapply every year. And so what students told us was that they were missing their letters because their address changed a lot. So right, obvious, but it was a real barrier to keeping their CalFresh application up to date. Students wanted healthy, easy food to grab and eat. So a lot of what was in the pantry was food that they would have to prepare. They said they don't have time to do that, or they don't have a good kitchen to do it in. And they really needed to be able to grab food on the go. And of course, after we did this project and I was going around all our local, the depot and the market, and looking at some of the food that's available there, like the easy stuff to grab and take on the go, it's like, oh my, it's full of sugar and not necessarily necessarily healthy choices, but if you really need to grab and go, what are you going to choose? And so, you know, it's kind of this complex dynamic where what students said they wanted was healthy food that they could just grab. Students were stressed out about parking on campus. I wouldn't have expected that to come out of the focus groups. It wasn't one of the questions, but it kept coming up. And that other thing that kept coming up was housing, and that students were feeling really stressed about finding housing, having to, like I said, you know, find one place for this year, and then if they went home for the summer, and having a place when they got back. And I remember that was actually hard when I was a student here too. We spent a lot of time looking for housing and dealing with property managers. I'll never forget one of the first apartments I lived in, they made my parent co-sign. And I was like, but I'm independent and I don't want my parent to co-sign. And I had a job, and that was a long time ago that I had experienced that, but people were still feeling that. And then on the really positive side, students were really happy that we had the pantry and they had access to food, and they kept saying over and over again how nice people were there. Like when they went there, they felt welcome and people were friendly. And over and over again, I hear in focus groups how much those kinds of things matter to people, just how you're treated when you walk into the dentist office, how you're treated when you walk into a class, anywhere. These things are they really make a difference. It's a small thing, but it matters to people. So some of what we learned, we've been doing this big project with oral health, and we did oral focus groups with parents who are on Medi-Cal. So Medi-Cal, of course, is the insurance package for low-income individuals. And some of the themes that parents told us was that they had really negative experiences at the dentist, and that was impacting their habits. And the other really big thing that kind of connects to that is the fear of the dentist. Like, I know we kind of joke about how people are afraid of the dentist and everyone's afraid of the dentist. Again, not surprising, but what we realized was that a lot of these folks, like, that fear was a really powerful, like, motivator or demotivator for seeking care. And when you think about the emotions associated with fear and being fearful of the dentist, and then they're worried that they're going to go to the dentist and they're going to find a problem and it's going to cost them money that they don't have, or they know their child hasn't been brushing their teeth. So these things were powerful for people. And even though we kind of knew it, it wasn't surprising, it just kept coming up. And another really interesting thing we learned was that oral health habits are established during childhood. So over and over again, parents told us, you know, they didn't brush their teeth when they were kids, and they were having a hard time getting that routine going with their kids. And so what we do as very young children, those habits kind of carry throughout a person's life. That was very interesting. And then these other two go to kind of how people feel at the dentist. And so just trying to access care was really intimidating for some people, for some of the reasons that I talked about. And then the environment of the dentist's office. And so when we talked, we did a focus group with Spanish-speaking parents, and they said no one speaks our language at the dentist office. And so that, you can understand, that would be make the environment of the office feel less familiar to them. And then the other big thing we learned, and we're working on this with our kind of collaborative team, is that we have 51,000 residents, which is about 40% of our population, the whole county, and only 5 clinics that accept Medi-Cal. So basically a lot of our adults, they can't find a dentist at all. They can drive out of county and try to get care there. But when you think about that people need to go twice a year to get the preventive care, they need regular cleanings, x-rays, exams. You can see why they only drive out of county when they're in pain and it's become an emergency, which is not how we want people to access care. Same thing with on the medical side. It's like seeking care before it turns into type 2 diabetes or these chronic health conditions that can be prevented. But you can see why it's really hard for some people to access care. And so this is a very kind of upsetting statistic about Humboldt County, and the reasons that private practice dentists don't take Medi-Cal are complex. It's not because they don't care about poor people. That's not the reason. It's because Medi-Cal dental is extremely onerous to apply for. It's hard to bill. They get reimbursed at a rate that barely covers their expenses. Their billing gets like scrutinized. They question, why do you want to fill this tooth? Why do you want to do this? And so there are a lot of reasons why private practice dentists don't accept Medi-Cal. And this is something that the Little Hoover Commission did an audit of Denti-Cal in California, and they just ripped apart the whole system. They're like, this system is broken and it disproportionately affects low-income people, people of color, people in rural communities, and the state has now a lot of pressure on them to try to do better. And I mean, it's a first step anyway to sort of disclose the dysfunction of that system. But it's been really interesting work. We've learned a lot, and there's a lot of work we're doing with the clinics and with other partners to try to address it. So moving on to adverse childhood experiences, and I probably have to get moving to get through my slides in time here. You probably all already know what an adverse childhood experience is, and you probably know that the more of those that you've had, there's an association with negative health outcomes later in life. What we really learned from this project, that we didn't have good data about ACEs with Humboldt County residents. And we learned that people that are working to address it are sort of siloed in their agency and organization. So there wasn't a lot of like cross-pollination of work. And when we looked at what all organizations in the community were doing around ACEs, we used this tool, the Spectrum of Prevention, which you can look up there. The Prevention Institute came up with it. And but basically the idea is that really difficult problems require attention to all these levels. So you need to strengthen individual knowledge and skills, but you also need to educate the community, and you need to educate providers, and you need coalitions and networks. You need to change systems and the way that they work, and you need to change policy and legislation. And so what we really learned was that most work was happening in this part of the rainbow, and people wanted to move the work toward policy level and system change. That was really what Humboldt was hungry for. Okay, and then the last quick feature, which this one I think is really interesting, was our community building initiative. So we did a listening campaign in the west side of Eureka, and we just asked people, knocked on doors, asked people, what are your top 3 concerns? Well, this is what people said. It's a really open-ended question, right? People just said they didn't feel safe. They said there was speeding through neighborhoods, there were vacant homes, it wasn't safe for kids to be outside, there were no street lights, they didn't know their neighbors, and people were acting out in public spaces, and it was making them uncomfortable. They were really concerned about drug use, non-visible and visible. So houses that were known as drug houses, people, drug activity in public, needles on the street. And then people were also concerned about children who were growing up in homes with addiction. And then the other thing was residents were really concerned about blight and crime. Cars were getting broken into, bicycles were being stolen, people's mail was getting stolen. People were really concerned about dogs barking at them and charging them. And they were concerned about, litter on the streets. They were concerned about homes that were kind of run down. They were concerned about broken windows. And so it was interesting that these were the things that people said they were most concerned about. And so based on this, we designed this project with 3 key strategies. And so one was improve nuisance conditions, increase resident connectedness, and develop a neighborhood network structure. So for improved nuisance conditions, they did community cleanup events. They worked with code enforcement to enforce existing codes, and then they tried to strengthen the codes that were in place to kind of regulate this. They developed opportunities for residents to meet each other. They did neighborhood walks, door knocking. They worked together on maintaining the community gardens and parks. And then finally, we did neighborhood networks. We formed a bunch of neighborhood networks, developed a closer relationship with the police to address safety concerns, and then we provided training and technical assistance to neighbors around, like, what is it you want to do and how can we help you do that? And so these are a couple of the pictures. That was a big community meeting they did at the beginning of the project, and then a huge group. This is at the Jefferson Community Center, which is a super cool place in Eureka you should check out if you haven't been there. It was a school that got shut down that they turned into a community center, and it's an amazing place. And then this is a pre-post picture of actually, building that playground. And that was a project that I was really excited about. So as you think about your careers, and some of this will probably seem obvious, but it's worth always reminding ourselves of these things. So, articulate your accomplishments when you work on a project or a paper, or you do volunteer work. Write that stuff down, and don't be afraid to be proud of the things that you do and accomplish, and document them because you forget. Think about what you want. Think about what you want in general, but also what you want to do, what you like to do. Get connected. Identify the types of organizations you want to work for, and then talk to them. Reach out, even if you're not looking for a position yet. People they like when you make that personal contact. Build your professional network, tailor your resume, and volunteer strategically. So think about volunteer opportunities that get you sort of toward the career that you want. I already kind of mentioned this, but make personal contacts with people. Ask for help. Access the resources that are available to you. The Career Center, there are places on campus that that are here to help you while you're a student, you know, take advantage of those resources. It always helps to have a mentor or coach. And it does mean, you know, reaching out and making personal connections. But you know what, it never hurts, whether it materializes into a job or not. Making connections is, you know, y'all know already, it's a positive thing. You can go to the Career Center for help with your resume, but again, I just recommend that you highlight your accomplishments, include relevant volunteer work, and then what I'm always telling our research analysts is keep your resume updated. So as you do new things, if you don't immediately update your resume, just keep it somewhere to where, oh, there's this job opportunity that involves mentoring youth, and I did do that in a summer program 5 years ago. I don't normally put it on my resume, but it might apply to a particular job. And omit information that's not relevant. So I know everybody, all the resumes I see now are like a page. I think that's kind of gotten through to people. 1 or 2 pages. Mine is 2. So, you know, what you want and what you want to do, this is some of what you can be thinking about. So who are you? What do you value? What are your strengths? What are you interested in? And then the whole personal brand concept, like what is it that you have that is unique? We're all like have a unique contribution to make. And embrace that. I mean, part of finding a career, like knowing who you are is actually really valuable. I don't know that I really knew that. When I was at the beginning of my career, I was just kind of looking like I need a job, and I wanted to try to stay in my field and be able to get a job that used my sociology degree. And then, you know, where are you going? So what kind of education, what kind of credentials, what kind of certificates do you need? And then what does success mean to you? And this is part of like, for some people, getting the highest paid position in an organization, that may not be your goal. It may be your goal. That's great, whatever your goal is. But success doesn't always just mean rising to the top. We think of it that that's what it is. That's kind of the myth. But it's not always the path to a happy, healthy life and a fulfilling career. So kind of knowing that about yourself and embracing that. If you really do want to be at the top, well, get started on the path there. And then, you know, you can have shorter term or longer term plans, but trying to build the skills and experience you need. It's really helpful to highlight relevant skills and experience on your resume and to seek those out if you don't have them. And then I would just say, especially when you're getting started in your career, is like think about your career goals, but also just your goals for life, for education, for travel, whatever those are, and write them down and think about what the first thing is that you need to do to get to that goal. And don't be afraid to think big. And if you kind of write those down and then maybe show them to someone, a friend or a family member, see what they think, and then start. And it could be, you could draw your goals, you could write them, you could just think about them, but it's good to think about what you want and the steps to get there. So I have, I put my email up there and I brought business cards if you want to learn more about CCRP or if there's anything I can do to help, or you have questions, I can make the slides available for you if you'd like them. And thank you for having me. that's a great question. So I think the biggest thing that's worked for us is you have to find an in to the community. So like in Bridgeville, we went to the Bridgeville Community Center and talked to them first, and then they pulled people from the community in. And we learned such interesting things like, oh, everybody goes to the post office because that's the only way that they can get their mail. And so that was a place where you could reach people. We learned that like residents who live along the same street, they know each other, and like when one of them goes to the grocery store, they like ask everyone else on their street, like, what do you need me to grab? And so if you can find, you know, one person on the street who knows, but you basically really have to have an in. And same thing with like working in tribal communities. It's like you've got to work with trusted people in that community. Even in the Eureka, the community building project, we hired someone who lived on the west side to do that whole listening campaign because, you know, it's like that trusted person. So you really can't go in alone. You can try, but you'll have more success if you're going in kind of vetted by a trusted leader, a trusted member of the community, and even then it still might be hard to reach everyone. But yeah, you've got to go in with a trusted member of a community that is gonna see you as an outsider. Yeah, great question. Are there any other questions?
Okay. Where did you get your experience writing grants? Like, for example, did you, before you were the director of health for CCRP? And how important do you think grant writing is for people wanting to be in the public health field?
Yeah, so question about experience writing grants and how important that skill is. You probably all heard it, but that is a great question too. The best way to learn to write grants is to write grants. It's really intimidating. I see this all the time. It's really intimidating to people, but it's not. It's a skill that almost anyone can learn. Part of it is, you know, looking at the grant application and, you know, answering the questions that are asked. Good writing skills are useful. I did take a grant writing class, a 5-day grant writing class, but I had already kind of been writing grants. It's funny because when I went to public health, there was a grant that funded my position, and that grant was going to end in like 6 months. And so my boss said, you need to write a new grant to keep your position. And I was like, okay, pressure's on, I gotta write a grant. And I got it, and then I got another one, and it gets easier and easier. Now I feel like you throw any grant at me, and I will, you know, I will write it, I will do my best. I feel really comfortable with it now, but it's just getting the experience of doing it. Even a really small little grant is good, and then just do it. And it is an extremely valuable skill, especially in the kind of field that I'm in, because I think that's how we get funded, is through grants and projects. And so being skilled in you know, attracting funding is a really important skill. But it is not as hard as sometimes it seems if you've never done it. It's just a matter of getting in there and doing it. And you don't get them all. It's just like every job you apply for, you're not going to get them all. But if you get one, all you need is one job. But one grant, then another grant. So, good question. Anything else?
So on that